Margot, I'm going to be talking about ICD10 and functional outcomes for therapy. These are coding systems that PTs use frequently. So ICD10 is the International Classification of Diseases. It's the 10th revision. In the US, ICD10 is translated into two sets of alphanumeric codes. ICD10-CM, or clinical modification, is the focus of this presentation. All providers covered by HIPAA use these codes to report for reimbursement for services, to calculate payment, to determine coverage, to compile statistics, and to assess quality. So here's some history about ICD. I do want to point out that ICD-9 was the previous version, and it was used for over 30 years in the US. It did eventually become outdated. ICD-10 was completed in 1992. It was adopted in the US in 2013 and implemented in 2015, which was a delay in, obviously, from 1992 to 2015, basically coming down to bureaucracy and the complex system in the United States. Here are some benefits of finally adopting to ICD-10 compared to ICD-9. You can look at that later. ICD-10 codes have been updated since implementation, and also ICD-11 is currently being developed. So there are slight differences in code use for inpatient versus outpatient. All non-outpatient settings require primary code, while in outpatient settings use first listed diagnosis or reason for encounter. And I'll go more into detail about order of listed codes. First, I will talk about the components of the code. There are at least 3 characters and up to 7 characters long. The first 3 characters are the category, and the next 3 characters provide details, and the 7th is an extension that I'll talk about later. And that's what this says. So when selecting an ICD-10 code to use, there are 2 lists to find the correct one. The first is the alphabetical index with general terms and their corresponding codes listed below. The tabular list is divided into chapters by body systems or conditions, so you always want to verify that you have the correct code using the tabular list. Some chapters of the tabular list include the 7th character, and they will have instructions at the beginning of the chapter for if the 7th character is necessary. Leave the slot empty if it's not necessary, but if it is necessary, you definitely want to include that. Here's more information on the 7th character if you're interested. So what codes are reported? Codes that support the medical necessity of therapy treatment. You may need to use multiple codes. Again, check the tabular list for some instructions for specific codes. Again, there might be multiple diagnoses, and you want to report the primary one first. There are also some combination codes to use for some multiple diagnoses. An initial counter may require external cause code to describe the cause of injury. There are also rarely used unspecified codes for when a patient presents with a condition that is not listed in the tabular list. So the primary diagnosis or first listed codes are the underlying condition. This can be indicated in the tabular list. It will say code first in the instructions. Secondary codes expand upon the description or cause, and they're listed second in your documentation. For PTs, be sure your documentation is complete with specific reason for encounter, and then you capture this with your G code. PTs may have an abbreviated list of commonly used codes for their setting, but they should be familiar with the method of finding codes to cover the entire range of patients. Additionally, your staff should be trained with this system, and here's a list of staff to think about. Oh, sorry. So here's some takeaways. Use the most specific code available with 7th character as needed. Support your code with clinical documentation. Your clinical site should audit these codes to make sure that documentation and claims agree. use the most current version, and remember that revenue can be impacted by coding. So next we'll talk about functional limitation reporting. So G codes are codes of functional limitation. These are information codes reported for Medicare Part B data collection. They describe patient beneficiaries of Medicare Part B. These are the categories for physical therapy. So to select a G code, pick the category relating to the primary reason for therapy. If multiple reasons exist, choose the one with greatest priority, would show the greatest progress, or is most relevant to a successful outcome. G codes must include a severity modifier. These reflect the percentage of impairment for each functional status, including current functional status, goal functional status, and discharge functional status. You can use your clinical judgment or an assessment tool. Here's a list recommended by the CMS that can help determine the percentage of impairment. So, who submits G codes? All outpatient settings billing under Medicare Part B. The department's reporting G codes include PT, OT, and SLP. When do we submit G codes? Visit 1 on or before visit 10, with every evaluation and re-evaluation, and at discharge, unless it's an unplanned discharge. Also, when functional limitation is ended, but you need more therapy, and when reporting that a new functional limitation has begun.